Good evening. Welcome to the Hamilton County Democratic Forum. I'm David Cook, and I'm a Democrat. If anyone wants a seat, there are a few seats up front, but there is scattered through here in the first couple rows, and there's also seating in the balcony. We don't want too many people to be standing in the back, so if it gets a little crowded, the staff may ask you to go upstairs. Thank you all for attending this very important forum tonight. I, along with my colleague, co-chair of the forum, Dave Altman. Dave, you want to wave at everybody? I'm going to serve as the moderators this evening. At this point, we're going to stand and recite the Pledge of Allegiance, if I can find the flag. It's on Steve's lapel. Okay, Steve's going to lead us in the pledge. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We are thrilled that so many of you have chosen to join us on this beautiful evening, particularly since there were two other healthcare forum events today. Senator Sherrod Brown today at UC, and Obama for America had an event at the Letter Carriers Hall in Northside earlier today. So we thank you for choosing to attend our forum and supporting this event. Because we have a very tightly packed agenda this evening, I'm going to ask everyone who is either a current elected official or running for office to stand up and wave, so that if anyone wants to speak to you or see you after the event or outside in the bar area, they can do so. So candidates and officials, please stand up. We'll also note that the chair of the Democratic Party is supporting us this evening, and we appreciate that. We are thrilled that so many people are interested in learning more about one of the most important and compelling issues of our generation, the reform of the healthcare system in the United States. We ask that you please observe the rules of civil discourse that will be presented to you on your way in and that were posted on the PowerPoint. As you are probably aware, Senator Ted Kennedy died a week ago. Ted Kennedy devoted much of his personal and professional life to reforming healthcare in the United States. He was a tireless advocate for healthcare coverage universally, and it is a sad moment that he passed away before he saw his life's work come to fruition. We would ask you to join us for a moment of silence to honor Senator Ted Kennedy and his work on healthcare reform. Thank you. We also note the passing today of a Cincinnati legend, a pillar of our arts and cultural community. Eric Kunzel died this morning, and that's a very sad event for our city. Okay, on to more hopeful things, and that's the reform of healthcare. Healthcare reform has a grand vision. That vision is to provide healthcare security and stability for all, for every citizen of our country. Healthcare reform as envisioned by the Obama administration would assure the availability of quality, affordable healthcare and fair healthcare for all Americans, regardless of health, employment status, or income. In the United States, more than 45 million people have no healthcare coverage. In our region alone, 210,000 people are currently without any healthcare coverage, and many are underinsured. Another goal of healthcare reform is to slow the skyrocketing cost increases of medical care and ensure that reform is cost neutral to the federal budget. Total national health care spending increased $900 billion between the years 2000 and 2007. It's projected to nearly double by the year 2018 if we just sit by and do nothing. A variety of views exist about how to accomplish these goals among Congress, the administration, interest groups, and certainly the public. Some advocate for no reform at all, hoping that reform will just go away. Others wish to scale the proposals back, making them less costly and keeping health care solely in the private sector. Progressives are disappointed that the single-payer system has been ruled out and that major concessions to private health care industry groups are being considered. Progressives, however, remain committed to keeping a public option available to compete with private insurance. It appears from listening to the news, looking at the media, the new media, blogs, you name it, that a majority in Congress actually support health care reform goals, but disagree on how to achieve those goals and how far to go in achieving reform. A growing consensus appears to support the need to rein in health insurance companies by banning underwriting practices that have prevented millions of Americans from obtaining affordable insurance. That's one example. A majority supports some kind of subsidy for people who cannot afford coverage. Misconceptions and fear is rife among the public. I think we've all seen too many examples of that. The fact sheets that were left on your chairs were intended to address some of the myths and misconceptions. We hope you take a moment to read those if you haven't had the chance already. Change is hard. We know that. The Democratic Forum's motto is change from the bottom up, and we believe that health care reform has to be driven from the public, from the grassroots, up to our elected representatives in Congress and to and through the administration. But if health care reform doesn't happen, too many people will continue to be priced out of affordable insurance, unable to pay their medical bills, health care costs will continue to soar, and others simply will have no coverage. Our program tonight is designed to assist you in learning more about the health care reform issues and specifically to learn what Congress looks at today when they go back into session after Labor Day, what's on the floor, what's going to be debated, and how is it going to affect us. So we're going to begin. Our program tonight is going to present speakers. We will have Steve Driehaus, Congressman from the 1st District, Jessica McNeese, the legislative aide for health care, to Senator Sherrod Brown. We're going to have a panel of volunteer citizens who are going to pose questions to our speakers. And then we've asked you to submit written questions to us, and we're going to randomly select those questions and pose them to the speakers. We have asked also that if you have a compelling health care story, that you put that on a card so that that can be related and the speakers can address that issue appropriately. Thank you for coming, and with this I'm going to have our first speaker, Congressman Steve Driehaus, present some outline